This lesson is about range of motion. Hi, I'm Kathy Getrist. Ever had the experience of not feeling well and therefore spending extra amounts of time in bed or laying around on the couch? Know how that felt when you got up? Your joints probably were a little bit stiffer, your muscles were weaker. To remain healthy, our bodies really need to be active. Patients that are confined to bed or unable to move freely just aren't getting enough exercise. This lack of exercise can cause all sorts of problems. Joints can become stiff and deformities can develop. Those are called contractures. Muscles can shrink, called atrophy, and lose their strength. Bones lose minerals very easily, and as a result, especially calcium loss, there's the fragileness of the bones and an increased chance for the bones to break. Also, a problem of not having enough exercise is a slowered body circulation. That means there's an increased chance of blood clots forming, particularly in the legs, and other complications. Therefore, you as the caregiver may need to help the patient to get enough exercise. This is called range of motion, sometimes abbreviated ROM. When range of motion is carried out by the patient entirely, it's called active range of motion. When the patient participates but needs assistance with the range of motion from the caregiver, it is called active assisted range of motion. When the patient is unable to help at all and the caregiver does it entirely, it's called passive range of motion. There are some specific guidelines that need to be followed when performing range of motion exercises. The first and probably the most important one is be certain to check with the nurse before you start. There may be some special instructions or some limitations that you need to know about. An example that comes to mind would be a patient that has reddened, swollen joints. If you would exercise those reddened, swollen joints, you could cause further damage to them. Another important guideline is always have the patient participate to the full extent possible. Encourage them to be independent. Utilize every opportunity for the patient to get exercise in their daily activities. This can be done by having the patient participate in washing themselves, feeding themselves, dressing themselves, or other activities of daily living. The more patients do for themselves, the greater the chance that they will have a real healthy self-esteem and healthy muscles and joints. The old adage, what you don't use, you lose, applies when we're talking about muscles and joints. Another guideline is start with the patient in good body alignment. Make sure the body is flat, the bed is flat, maybe with just one pillow underneath the head, or they could be sitting upright straight in a chair. The patient should be covered, warm and comfortable to promote muscle relaxation. And be sure, only expose the body part that happens to be exercised at a given time. Always follow a logical sequence so that no joint gets missed in doing range of motion. An example would be to start at the shoulders and proceed on down to the toes. Be gentle in your movements. Move the joint slowly and smoothly. No jerky motions. And always remember to support the joint. Never bend or extend the joint to the point of pain. Do not exercise swollen or red joints at any time. Stop the exercise if the patient is complaining of an unusual amount of pain or discomfort. And finally, do a minimum of 3 to 10 repetitions of the range of motion with each joint or as directed by the care plan. There are specific terms that describe the way that joints can be moved. You'll need to know these terms in order to exercise each muscle and joint through its full range. The first one is called flexion. Flexion means to bend a body part. Next is extension. That means to straighten it. The next is called abduction. Abduction means to move the body part away from the body. And adduction means to move that body part back towards the body. A way to remember adduction is that you are adding the limb to the body. Internal rotation of the shoulder is moving the forearm downward. External rotation of the shoulder is moving the forearm upward. Pronation is putting the palms down. Supination is turning the palms up. Opposition means touching the thumb to each one of the fingers on the same hand. Internal rotation of the hip is turning one foot and leg toward the other. External rotation of the hip is turning that leg and foot away from the other. Inversion of the foot means to turn the foot inward. And eversion of the foot means turning the foot away or outward. Dorsiflexion is bending the ankle so that the toes are pointed upward. Plantar flexion is extending the ankle so that the toes are pointed downward. Lots of terms, but very important for you to be able to learn them. Now please watch as range of motion exercises are being demonstrated by one of the caregivers.